Hello everyone, I'm Dr. Ashish Kuragai and today we'll be studying about clinical anatomy of the lymphatic organs. So the lymphatic organs are primarily divided into two types, primary lymphatic organs and secondary lymphatic organs. So you need to understand that primary lymphatic organs, they are associated with producing and maturing the lymphocytes, all right? So they produce and mature B cells and T cells. So there are two primary lymphatic organs, bone marrow and thymus. All right. So bone marrow produces mature B cells. All right. And T cells are also produced in the bone marrow, but the T cells are matured in the thymus. All right. So the bone marrow produces mature B cell. The B cells are matured, but they are naive. That means they are not exposed to the antigen and they are not activated. So they are mature, right? They are capable of being active, but they are not activated because they are not presented with an antigen. They are not exposed to an antigen. So they are capable of performing their function, but they are naive. All right. Now, bone marrow produces T cell as well, but the T cell maturation occurs in the thymus. All right, that's all you need to know. Now let's talk about secondary lymphatic organs. So the only thing you need to understand about secondary lymphatic organs is that they activate the mature B cell and T cell. So B cell and T cell, when they are matured, they get collected in these secondary lymphatic organs. All right, and when they're exposed to an antigen, then they are activated and then they are fully capable of performing their function. And then they differentiate into different types of T cells and different types of B cells. All right. So this differentiation and activation occurs in secondary lymphatic organs after being exposed to an antigen. So let's look at some of the most important secondary lymphatic organs. They are spleen, lymph nodes, tonsils, and Peyer's patches. So these are the most important ones. So antigen presentation occurs via antigen presenting cells. So for example, let's say antigen presenting cells capture an antigen in the skin. All right. So via the draining lymphatics, these antigen presenting cells come to the lymph node and present this antigen to the B cells and T cells. All right. Then they divide into mature effector cells. All right. The mature naive cells divide into effector cells. All right. Now, we have talked about bone marrow, and from exam point of view, that's all you need to know. It produces B cells and T cells, but B cells, when they are produced, are mature. T cells, when they are produced, are not mature. And this maturation of T cell occurs in the thymus. That's all you need to know. All right. Now, talking about thymus, this is super high yield from exam point of view. Now, one of the most important things that they ask in exam is the embryology. So you need to understand that thymus has two origins. The epithelium develops from the third pharyngeal pouch, all right, the endoderm. E for E. Epithelium develops from the endoderm. And it's the third pharyngeal pouch. Super high from exam point of view. Now, thymic lymphocytes, they develop from the mesoderm, all right? Epithelium from the endoderm and the lymphocytes from the mesoderm. So in exam, they'll give you a question about myasthenia gravis. And you know that myasthenia gravis is associated with thymoma or thymic hyperplasia, right? And then they will ask, which of the following is the origin of this associated organ. All right. So first you need to identify that the patient has myasthenia gravis. Then you need to associate it with thymoma. All right. Then they will ask you which of the following is the origin of this thymus. All right. So this is one way of asking a question in the exam. Now, the most important thing that you need to learn from this slide is the clinical relevance. So they will ask you numerous questions about thymus, all right? So you need to understand that thymic hypoplasia is associated with DiGeorge syndrome and SCID, all right? Severe combined immunodeficiency syndrome, all right? So they'll give you a clinical scenario of DiGeorge syndrome, all right? They'll tell you there's immunodeficiency, the patient has recurrent infection, the patient has hypocalcemia, things like that, right? And then they will ask you which of the following organs will be hypoplastic, right? Or they might give you that on examination, thymus is hypoplastic. Which of the following is the disease? All right. So there are numerous immunodeficiency syndromes, and the clinical scenario or clinical presentation might be similar. But this point that there will be thymic hypoplasia will help you to narrow it down to DJOS syndrome or SCID. All right. So DJOS syndrome and SCID are associated with thymic hypoplasia, super high yield. Now, another clinical association that they love to ask is thymic hyperplasia. So, thymic hyperplasia is associated with myasthenia gravis, SLE, and rheumatoid arthritis. So, I talked about myasthenia gravis earlier, but they will ask you a question about rheumatoid arthritis, and they might ask which of the following organs are hyperplastic. All right. So, they'll give you a 25-year-old woman presents with joint pain, knee swelling, stuff like that. And then they will ask you which of the following organs are hyperplastic. All right. Another super high yield point is thymoma. So it's a tumor of epithelial cell. All right. It's a tumor of epithelial cell. And like I said, myasthenia gravis is highly associated with thymic hyperplasia and thymoma. All right. And other disease associated with thymoma are pure red cell aplasia and immunodeficiency with thymoma. All right. These three are super high yield and associated with thymoma. So now let's talk about the structure of a lymph node. Now, this is afferent lymphatics. This is where the lymph node receives the lymphatic fluids, all right? So it comes from the afferent lymphatics and then it leaves from the efferent lymphatics. The lymphatic fluids come from here and leave through here, all right? Now, the most important thing that you need to understand from exam point of view is cortex, medulla, medullary sinus, and the follicles, all right? Super high yield. Now, let's talk about cortex. So, cortex is also known as the B cell zone. All right. It's called B cell zone because B lymphocytes are stored here. All right. So, the B lymphocytes are housed in the cortex. All right. So these are follicles, all right? Now this is a secondary follicle. I have not shown primary follicle in this image, but the difference between secondary follicle and primary follicle is that secondary follicles are the active ones, all right? And primary follicles are inactive. The secondary follicle has this pale germinal center. Can you see this pale part, right? Compared to this purple, this is a bit pale. So if you see a pale follicle, it means that it's the active follicle, all right? It's the secondary follicle. If this follicle didn't have this pale area, let's say there were this purple area only, let's say this pale center was not present, then that would be primary follicle. Now, follicles have B lymphocytes, all right, super high yield. So, lymphoid follicles are the sites of B lymphocyte storage, differentiation, and proliferation. The way the question is asked is B cell activation occurs after an antigen exposure, right? Let's say you get a bacterial infection and you need to produce antibodies against that infection, right? Against that organism. So B cell needs to be activated, differentiated, and proliferation has to occur to produce those antibodies, all right? So this activation proliferation occurs in secondary follicle. So this is how they will ask you a question. They'll give you a vignette of the infection and then they will ask you which of the following locations of lymph node are involved in this process. All right. And then you need to understand that, okay, it's the secondary follicle where the action happens. It is where proliferation of B lymphocytes occur. All right. So that's one way of asking question in the exam. So secondary follicle is super high yield. And primary follicle, although there are B lymphocytes, they are naive. All right. So primary follicle, they house the naive B cells, but this activation occurs in the secondary follicle. Super high yield from exam point of view. All right. Now, this is cortex. All right. So follicles are present in the cortex. Now, this is medulla. All right. This is medulla. And the reason between cortex and medulla is called paracortex. Now, paracortex is super high yield from exam point of view because it is the T cell zone. The cortex was the B cell zone, but the paracortex is the T cell zone. All right. So it houses T cells. So it is the site of T cell activation. Cortex is the site of B cell activation. Paracortex is the site of T cell activation. Super high yield from exam point of view. Now this is medulla. So medulla has these medullary cords and the sinus, all right? And you'll get numerous questions about medullary cords and medullary sinus. And the way they will ask you question is that medulla houses the macrophages, all right? So specifically the medullary sinus, all right? Medullary sinus has macrophages and reticular cells, all right? So medullary cords, they have plasma cells and lymphocytes. So they are packed with plasma cells and lymphocytes. But sinus, medullary sinus is unique because it has macrophages. All right, medullary sinus is unique because it has macrophages, and you'll get numerous disease where macrophage activation occurs, right? So the way they will ask you a question is, let's say a patient has tuberculosis, right? And you know that in tuberculosis activation of macrophages is so important, right? And then they will ask you, where are these macrophages located, right? And then you need to know that it's the medullary sinus which has macrophages, all right? So these are the most important structures of lymph node from exam point of view, all right? So it's not possible to go into every detail of the structure of lymph node, but from exam point of view, all you need to know is cortex is the B cell zone, paracortex is the T cell zone, and medullary sinuses, they have macrophages, all right? So these three are the most important things, but other stuff that we discussed in this slide are super high yield, but the most important ones are cortex, paracortex, and medulla, all right? Now, lymph nodes, like I said earlier, these are the sites where antigen presentation occurs and the activation of B cells and T cells occur, right? So we have talked about cortex as the B cell zone, and we have talked about follicles, all right? We have talked about secondary follicle and primary follicle. Secondary follicles are the active ones, primary follicles are the inactive. So primary follicles, they are inactive, they are dense aggregates of the naive B lymphocytes. But secondary follicles are pale and the active B cells, all right, the mature active B cells are present in the secondary follicle. This is super high yield from exam point of view. Now, paracortex, the T cell zone, all right. Now, we have talked about medullary cords and sinus. Cords, they're packed with plasma cell and lymphocytes, and the sinus, they're composed of macrophages and reticular cells, all right.